There are more than 3 million cases of it diagnosed in the U.S. every year. We're talking about coronary artery disease. This morning on Ask a Specialist, we're talking about what you need to know with Dr. Randolph Hutter, cardiovascular disease specialist with the Queen's Health Systems. Good morning, doctor. Thanks for joining us today.
Good morning. Thank you for having me today here and allowing me to speak to this important topic.
Yes, it is very important because this disease, it affects millions of people. So what exactly is coronary artery disease?
Well, coronary artery disease is a process that we also call atherosclerosis. It's a change in the inner lining of the arteries. It can happen in any artery of the body. And when it happens in the arteries that supply the heart, which are called coronary arteries, we call it coronary artery disease. Many people think of it like a concept of plumbing with some inert material blocking up the arteries, but essentially these lesions that form there, these so-called atherosclerotic plaques, they're made out of living cells, and they're really living tissue. And we all have some degree of atherosclerotic changes in our arteries, but many of us live with these mild changes without it ever becoming a disease. And in some of us, at some point in their life, these atherosclerotic plaques become a real disease by progressing to either a larger lesion, a bulky plaque that gradually obstructs the artery, or even more problematic for us as physicians, they can become unstable and they can rupture and cause an acute blood clot, like a pimple on the skin can rupture. These lesions can cause obstruction of the artery that's acute and can cause heart attacks and strokes. And we all have a different risk factor profile that makes us more or less predisposed to have that problem. The most common, well-known risk factors are, of course, to be male. Age is a big risk, especially when you hit 50 and above. And high blood pressure, high cholesterol, smoking, and diabetes are the big ones. But there is also a family history component where the disease can run in families even when not many other risk factors are present.
And what types of symptoms does this disease cause?
Yeah, that's another very important topic for everyone to know, that even though we have this typical angina concept that patients describe, that elephant that's sitting on their chest, but we shouldn't be dogmatic about these symptoms. They can come in extremely varied type of patterns, and they're felt differently and described differently by everyone. Particularly females have what we call more atypical symptoms, which can be neck pain, jaw pain, shoulder blade pain, heartburn symptoms sometimes. And sometimes when the blockages are very upstream and cause a lot of blood flow impediment, even just shortness of breath can be a symptom, and not being able to do physical activities anymore that patients could do before. So it's really important to pay attention to those symptoms. They are very non-specific, so not every time you feel that it means you have the disease. But if you have a risk factor profile that predisposes you to it, it's always good to be tested and to prove if these symptoms are related to the disease or not.
And that leads me to my next question. How do you test for this disease, and how is it treated?
We do test basically based on the symptom patterns. Those patients that present mainly with exertional symptoms, like severe exertional shortness of breath or exertional chest pressure, they perform stress testing with us, where they walk on a treadmill being hooked up to an EKG, and we look for symptoms and EKG patterns. That's the most basic form of testing. Then we can combine that treadmill walk with imaging of the heart, where we use an ultrasound to show the wall motion of the heart muscle after the patient walked on the treadmill. Or we can use nuclear traces to show the blood flow to the heart. Some patients that cannot walk, they get a medicine that mimics the exercise. And this is the program we use for so-called exertional symptoms that come on with exercise. Those patients that have symptoms at rest when they do nothing, this is the higher risk category. This relates to those plaques that could rupture. And those patients, we like to visualize the arteries. For them, it's not safe to be on the treadmill. They get pictures of the arteries either with a CAT scan and a dye injection, through the vein in a non-invasive way, or the gold standard to test for this problem is to go with a small catheter to the heart and inject the dye directly in a small procedure that's called cardiac catheterization. This is the final test also for those that have positive stress tests. This is where we find out the truth about the problem.
Okay, and there are options if you are diagnosed with this disease, and you can treat it. So to learn more about coronary artery disease, Queens will hold a free virtual speaking of